Okay, so good afternoon, everyone, and thank you for joining us today for the second webinar in our Heart Health series in February. My name is Lakin Chapman, and I'll be your moderator for today's health talk. Today, we're going to talk about women's heart health and hear the inspiring story of one of our own physicians, Dr. Karen Gooslin. Before we get started, let me tell you a little bit about Appalachian Regional Healthcare. ARH is a nonprofit healthcare system operating 11 hospitals in southeastern Kentucky and 2 in West Virginia. We are the largest provider of care and the single largest employer in southeastern Kentucky, and the third largest private employer in southern West Virginia. We operate multi-specialty physician practices, home health services, home medical supply stores, physical and occupational and speech therapy, retail pharmacies, and much more. Our mission is to improve the health and well-being of the people of Appalachia, and these webinars are one of the many ways we try to fulfill that mission. So some housekeeping items before we get started with today's webinar. The Q&A section will be open throughout the webinar, so please feel comfortable in asking questions and participating. Our experts cannot provide specific medical advice or referrals on this webinar. So should you have any questions about your personal health or need a referral, please consult your healthcare providers for diagnosis, treatments, and answers to personal questions. If you do not have a provider, please visit arh.org, where you can find a listing of our providers that can help you. As I said before, our speaker today is Dr. Karen Gooslin. Dr. Karen Gooslin is a local of Eastern Kentucky, growing up within the Floyd County region, where she graduated high school from Allen Central. She then went on to complete her undergraduate and medical career at Pikeville College. Since completing medical school, she went on to specialize in internal medicine with a dream of returning locally to serve the community that helped raise her to the woman she is today. Dr. Gooslin has been living that dream for the past 11 years by practicing medicine at McDowell ARH, where she is now the Vice Chief of Staff as well as the ER Medical Director. Today, Dr. Karen Gooslin is joining us to discuss ways to identify and lower your risk for heart disease by discussing the differences in prevention, diagnosis, and treatment in women. So, Dr. Karen Gooslin, I'm going to hand it over to you for you to begin.
Thank you, Lakin. Like she said, I'm local here to Eastern Kentucky, and some of you all have heard me talk about my own medical health before, especially if you're patients or coworkers of mine. I come in here today to talk to you about kind of like diagnosis of the heart disease. So let me tell you a little bit about my story, because I think that people understand more when they can put a face to a story instead of just throwing some facts out to you. So I'll be 42 years old next month, and I'm telling you my age for a reason, because when you think about heart disease, you want to think about your grandmothers who have heart attacks in their 60s and 70s, but people don't realize that heart disease starts earlier in life, and that's when you need to start focusing more on it and not waiting until it's too late. I was diagnosed with heart disease at a young age, and this is kind of my story with it. I got diagnosed 8 years ago at around 35 years of age, when actually I thought my health was at its best. I was exercising, I was running, and then it just kind of hit me out of the blue. So I'll talk to you about my story, but to understand my story, I'll tell you a little bit about where I came from in my past, for the ones that don't know me. During high school, I was always active in sports. I was always physically fit, playing basketball, softball. My body mass index was just, it was just the best it was. During college and medical school, I elected not to play sports. I focused more on my academics, which led to a more sedentary lifestyle of studying, eating late, night fast food, and staying up late and studying and just snacking. So, of course, I gained weight when we got to college. Everybody hollers freshman 15 pounds. I battled my weight throughout my 20s and into my early 30s. I didn't realize at that time what I was doing to myself. I was so focused on trying to balance medical school, college, marriage, having children, just life in general, trying to figure my way out in this life. Many 20 and 30-year-olds are like that now. They don't think about their health. They just think they're invincible, and they're just trying to be productive in life. During my first pregnancy, I was diagnosed with gestational diabetes and preeclampsia. I was 25 years old. FYI, I'm going to throw in tidbits of information here as I go through my story, and hopefully you'll remember it. Both of those, the gestational diabetes and the preeclampsia, they're both risk factors for heart disease later in life in women. So people think that just while they're pregnant, they're dealing with this. No, it actually is a risk factor that says, hey, you may have heart disease later on in life. And sometimes that don't get told to these young kids that are pregnant. I began having heart issues while I was in medical school, which was around my mid to late 20s, right after my first child. I was on rotations one day and my heart started racing and I didn't feel good. Felt like I was going to pass out. And I went to the cardiologist and they diagnosed me, with this inappropriate sinus attack, like my heart races fast, just because they don't know why. A lot of these diagnoses, especially in young kids and young adults, get thrown off on these caffeine use and energy drinks, which both are bad. I agree. But we have to realize that sometimes it's not just the energy drinks and the caffeine, that something may be underlying. And fast forward a couple years, they put me on medicine to help control my heart rate. I was finished with medical school, doing residency, seeing that light at the end of the tunnel. Had my second child, now in my early 30s, and I was morbidly obese, which is a risk factor. And I looked in the mirror one day and I realized that, what have I done to myself? Here I am trying to convince my patients to choose better lifestyles, and I'm obese myself. So I kept telling everyone, I wanted to do something better. It's looking like you sitting there smoking, but then you tell your patients not to smoke. It's kind of like, the old saying, pot calling the kettle black. But, I had to do something about it. So I made a difference and I made a change, which smoking is another risk factor. So is morbid obesity. So at the age of 32, I decided to take better care of myself. Started practicing what I was preaching to my patients. I want to be a role model to my two young girls. And so I lost about 100 pounds. Now, I did not do this overnight. I did not do this with any type of fad diets. It took me about 3 years to lose 100 pounds. I changed my eating habits and I started exercising. I did it slowly so that it's more likely to be a permanent change. So once the weight came off, I started running, and a lot of people, I used to run, the 5Ks around here and help support locally. And I would run around 2 to 3 miles every evening, about 3 or 4 times a week. And it really helped. It helped with my stress level. I felt better. I slept better. So here's a little healthy tip while we're talking about this. And I'm going to teach you, like I said, as I go through my story. The Department of Health and Human Services recommend at least 30 minutes a day of exercise for 5 days a week. That doesn't mean that you have to go and work out for 30 minutes. You just make small options. And this is kind of what I live a very busy life. Sometimes you'll see me at different hospitals. I'll work 60 to 80 hours a week. So it's hard to get exercise in. So you have to make little changes. Take the stairs instead of the elevator. While you're washing dishes, march in place, just move. While you're folding laundry or watching TV, get up and march or move your arms. When you go to the grocery store, don't fight over that closest parking spot. Park a little further down and get a few extra steps in. Little differences like that can make a big difference overall and in the years to come. So back to my story. So running to me was good for my soul. I do miss it quite often. I don't do it right now because of some other health issues. So if you guys are keeping up with me now, I started wanting to make a difference in my life around 32. Took me about 3 years. So by 35, I was in the best shape of my life. I still taking a little bit of medicine to help control my heart rate, but had lost 100 pounds, was feeling good. That's when God decided to throw me a curveball. That's what I say. God obviously thinks that I'm a lot stronger than what I think I am, because sometimes he puts a lot on my plate. But I just take it and roll with it. I started having trouble with my heart at 35. And again, I went to multiple doctors, multiple cardiologists in Lexington, all the way back here. No one really wanted to take me serious. I was 35 years old and best shape of my life. It took a while, and that can be frustrating. It took 2 years before I got a diagnosis. It just seemed like it was so depressing, because they told me not to exercise as much because that would cause the heart issues to happen with me. So it took away the one thing I enjoyed, which was running. So they told me, of course, not to drink any energy drinks, to reduce the stress, which I kind of laughed at them. I said, do you realize what I do every day? They tried different medicines. Nothing really worked. Stress is another big risk factor for cardiovascular disease. So you're starting to see a little pattern here with me. I had the preeclampsia and the gestational diabetes. I was overweight for a time. I have a high stress job. Plus, I'm having all these symptoms. And my mother had an early heart attack in her 40s. So that's another big kind of X on Karen, because I have early family heart disease. So that's a risk factor too. And I'm a woman, which increases our risk too. Actually, coronary artery disease killed close to 300,000 women in 2017. So that was about 5 years ago, right after when I was getting diagnosed. 1 in every 5 female deaths was related to coronary artery disease at the time. And about 1 in every 16 women ages 20 and older have coronary artery disease. It's not just a disease of older women. This begins when we're young, but it can be silent until it's too late or until it progresses so far. So it starts at a young age, and that's the reason why that I tell my story, because I want people to realize that they need to take this into heart and consideration at a younger age. And that's the one thing I want most people to take away from this story, that it begins early in life. So let me get back to my little saga. So let me give you the short version kind of from here. You fast forward to the current day. I am status post multiple cardiology appointments. I've been through EP cardiologist, multiple stress tests. I currently see our Dr. Emmerich at Hazard. He is a wonderful cardiologist and monitors me. I also see our EP cardiologist over at Hazard as well, along with UK, and they have worked together and been phenomenal to get me back doing a lot of my stuff. I've had EKGs, I've had Holter monitors, I had echoes, I had a cardiac CT scan. My cardiac CT scan was done 5 years ago. And for you all that doesn't know what a cardiac CT is, it's a CT scan that shows the function and the vasculature, like your arteries and your veins in your heart. And it can kind of tell you if you're at risk for blockages without doing a heart cath. So my cardiac CT scan was done, like I said, 5 years ago. They give you a number and they kind of age your heart. They say your heart is the equivalent of a 60-year-old or a 42-year-old, or kind of go from there. My vascular age 5 years ago, which would have been 37, almost 37, was 82 years old. I had the vascular age of an 82-year-old at that time. And that's what shocks people. I had 2 cardiac ablations. I have a heart arrhythmia. I've had 1 heart catheterization, and that was a couple years ago. I have 2 40% blockages in 2 of my main arteries. I don't have any stents or no open heart surgeries. I take medicine daily. I watch what I eat. I eat low-fat diets. Take my cholesterol medicines and my aspirins. And I have an implantable heart monitor that monitors my heart arrhythmias daily to watch for it. So not what you think a 36 or a 37-year-old should be doing at that time. It took me 5 years of testing and changing medicines to be able to get an answer and to start running a little bit again and exercising. Then COVID kind of threw a loop in my health as well. And if for you all that don't know my history with COVID, that's another story and lecture, but I got very sick with COVID. Got some heart issues on top of my other from it, and having a little setback. It's been a year and a half now since I've had COVID, and I feel like I have progressed very well and getting back there every day. I did gain some weight back. I'm not 100 pounds down anymore. I struggle with that daily, just like everybody else does. But I know my risk factors, and I know how to prevent what I can. I can't change my genetics, but I can change my life choices. And yeah, there's days I fail. I fail every day. I'm not perfect. No one is. But how I react to those failed days is that I think makes a difference. I don't say, well, that's just it. I'm not going to try. I just restart the next day. There's a joke in my clinic. We will start a diet, we say, every Monday because we never make it through the week. So that's our joke in the clinic here. I'm not here to scare you about heart disease. I'm here to share my story in hopes that it helps someone. Like I said, sometimes it's easier to remember things if you can put a face to it. That's the reason why I didn't do a presentation today. Heart disease can affect women, young or old. You don't wake up one day and have blockages in your heart. Those build up over time. We need to prevent those from building up and start being more preventative at younger ages. Do not ignore your signs of heart disease. You have chest pain, pain between your shoulder blades, a jaw pain. Those are your obvious ones. But as women, we don't always read the textbook. It could be just increased fatigue for no reason. It could be bloating, like your belly's just full. It could be sudden nausea that you don't know why. It's always good to come get it checked out. Whether it's with your family doctor, having an EKG yearly and having it followed up, or if it's intense, come on to the emergency department. ARH always is open with our ERs. I work several of them. I'll never, no matter what age, I always say it's a good thing you should always come to the ER for chest pain. I don't care if you're 20 or if you're 80. Don't wait until the heart disease has progressed to a heart attack. Do something about it before then. Let's see. What have I forgot to tell you? Of course, as women, we often push our needs and we always want to be go, go, go and take care of everyone else. But you have to take care of yourself to be able to take care of others. So, your risk factors, watch for diabetes, obesity, inflammatory diseases like your rheumatoid arthritis and lupuses. Those are risk factors people don't think about. Sleep apnea, huge risk factor. Family history of early heart disease, big risk factor. Know your blood pressure, know what it is. Smoking, it's another option. That's something that you can change. And so make that choice for you. And that's a little bit of my story. I know, let's see, Stephanie says, is having mild chest pain after a hot shower a sign of cardiac issue? That's a little bit of a hard question. So chest pain after a hot shower could be so many different things. You get a histamine reaction after you get a hot shower. So that could be that as well. It depends on your other risk factors and how you feel and stuff. So that's something you may need to talk to your family doctor about and let her go back into details about that. Any other questions? I'll be quiet, that way we can ask questions and see in case you all want to know anything about any of the heart disease or questions about my story. So the signs of a heart attack in women versus men. Like I said, men is, we hear a lot, men will come in saying they have that crushing chest pain. It's like an elephant sitting on their chest. It's hard to breathe. They're nauseated. A lot of times it will radiate to their jaw, left jaw, or their left arm. That's your textbook classic heart attack. Men usually do that as well today. Women, like I said, we don't read the book. We don't read textbooks. We never have. We do things our own way. It could be very simple. It could be upset stomach. It could be just a little discomfort. Something that we think is just heartburn, or just, I just don't feel good for a few days and fatigued for no reason, though you're sleeping good. It could just be decreased in the ability to function. So it's a big difference between men and women. There's women's symptoms, especially diabetic women. Diabetics are sometimes very silent. You don't have many symptoms at all. So it's always good to get your yearly EKGs if you have risk factors, and talk to your provider about your cholesterol and your blood pressure goals, your sugar goals. Should I be taking a baby aspirin? What medicines should I take to be preventative? Birth control is a risk factor. The question is taking birth control pills a risk factor for heart disease? It can be as we increase with age, with hormones, and our usually around birth control pills, we stop around age 40 because of that increased risk when you start into menopause and the extra estrogens and hormones. So it's not that early on it's a risk, but as you get older, it's a risk. That's the reason why you don't see a lot of over 40 on birth control pills. So let's see what else I got. Are individual cholesterol numbers more important than total cholesterol? And it does. You really need to know your total cholesterol could be good, but then when you look at your individual cholesterol levels, you have a good cholesterol and a bad cholesterol. The good cholesterol is your LDL, and you want that as low as possible if you have cardiac risk factors. Your HDL is your good cholesterol, and you actually want it to be a little higher. And there's certain ways, dark chocolates, red wine, a glass of red wine a night. Those are all ways that you'll hear doctors talk to you about increasing that good cholesterol. We also have statin therapy that we put people on that will sometimes raise your good cholesterol and decrease your lower cholesterol as well. There are the question is are there female specific disorders that increase a woman's risk of heart disease? There is. PCOS is definitely one of those. Metabolic syndrome is another one as well. You may not hear a lot about metabolic syndromes, but that is kind of like a trifecta of obesity, abnormal sugar issues, pre-diabetic or diabetes, and hyperlipidemia or hypertension. And that usually is more genetic. You'll see those run in families of metabolic syndromes, and they usually have PCOS, which is your polycystic ovarian syndrome. Let's see, make sure I'm getting everything here. Any other questions for me? Since I was young, I randomly have sharp pain in my chest for just a few seconds and can't breathe, and then it's fine. Again, that's hard to tell without further workup. It could be vasospasms, it could be muscle spasms, it could be so many different things. If you're always concerned, I always tell my patients to come in and talk to me. So I definitely would come in and talk to your family doctor about that and just have an EKG. That way, one, it decreases your worry about it too. The question is what are some behaviors that can help prevent heart disease? Again, lifestyle changes. I talk to my patients about doing lifestyle changes all the time. I don't like the words diets. People do not like to hear the word diet because diets you stay on for just a little bit of time, and then once you go off the diet, people most of the time gain their weight back or whatever. So I do lifestyle changes. You want to get out and exercise, find a way to de-stress, find a hobby, walk. I used to use running and walking to clear my head, to go through my activities of the day, just a quiet time. I'd listen to music, and sometimes I'd talk to God and say, okay, what have I done today, or what do I need to do? But just find something that works for you. Lifestyle changes, find little ways to get that 30 minutes of activity a day. I started wearing an Apple Watch, where a lot of people have now, that watches your heart rate, but it makes me more conscious of my activity levels. There's some days I'm more sedative now that we went to virtual stuff, so I don't get up and move a lot like we used to, because we're doing more virtual visits. So that tells me, hey, get up and move around. You've not moved around in a while. Diet changes, not diets as in a diet like your keto diets and all that, but dietary changes. Choose healthier options. I'm not diabetic. Will I probably be with my family history and gestational probably one day? But I'm going ahead now and changing those options. I do a lot of low carb and low sugar or no sugar food options, so that I'm going to try to prevent turning diabetic for as long as possible. So you have to make that decrease your stress levels, talk to your providers. There's definitely ways that you can make a change. You have to be proactive, and it needs to start early, not once you've already got the disease. You need to be proactive with this. Any other questions or comments? I'm kind of waiting to see if anybody types anything. And of course, I'm always available if you all have any questions offline too. Are the hormones, and the question is, are the hormones given at menopause concern for heart disease? When your provider gives hormone medications, they are taking in your risk factors at that time. So they are doing the safest, most possible way. So that is one of the considerations when we use hormone therapy, especially your estrogen therapy. And we don't like to use it on people that it's high risk for early heart attacks and strokes, along with your cancer risk as well. So that's something that your doctor does take into consideration when and if they are prescribing you hormone therapy. There is safe hormones out there that you can take. So don't think just because you're on hormones that it's a bad thing if you have coronary artery disease or risk factors, because there is safe ones out there as well. We have another question. It says, if you make the lifestyle changes now, can you correct any heart disease or damage? If you have heart damage, it's very hard to correct. It's kind of like the damage is done, but it is able to. The heart's a wonderful thing. If you have a heart attack and it's not working well, it can, with the right medicine and changes, function better. If you make changes now, it will definitely slow down and help some of that. They do make medicines as well, and lifestyle changes help to decrease your risk and to help some of that plaque resolve and help reverse some of the damage. Can it reverse it 100%? No, but it can make a difference. That's the reason why prevention is kind of pushed so much, and being proactive and stuff with it. Question, it says, I have been on high blood pressure medication for high blood pressure since I was 22. There's another, person like I am with the blood pressure. I'm 41 now. Is it okay to be taking blood pressure medicines this long? It is. You're probably, if you've been diagnosed with it that long and have been on it for 20 years, this is probably going to be a lifelong thing for you. And I would assume that you probably have some genetic issues as well, with family history of coronary artery disease. So it is safe. It is okay, because without the blood pressure medicines, your blood pressure is going to be high and you're going to be at higher risk. These medicines are safe to take. With my patients, I check their renal functions or their kidneys every 6 months, and we kind of watch other things as well, because high blood pressure and coronary disease has issues and can cause complications with your kidneys as one of them. So we do watch that, but it is perfectly safe to take blood pressure medicines for extended periods of time if you need them.
Give it a few more minutes, see if any more questions pop in. We've had some great questions so far. Looks like that may be all for questions. Dr. Gooslin, I want to thank you for obviously coming and participating in this talk with us, and everybody for attending. There were some awesome questions that were asked, and thank you for also sticking around, Dr. Gooslin, and answering all the questions that was sent in. As a reminder, just to everybody who is attending, this was the second in our Heart Health webinar series, and everyone that attends at a webinar in this series is entered to win some really cool prizes. So we are giving away HelloFresh gift cards after every webinar, and an overall grand prize of a Mirror Home Gym and a 1-year subscription to those that have attended all 4 webinars. So make sure you register for the remaining 2 webinars we have in our series. So our next webinar discussion on heart health is heart health after a COVID diagnosis is on February 22nd. The link to register is now in their chat box, as well as all the hospitals have been sharing them on their social media accounts. So if you're not able to grab it in the chat, just hop on over to any of the social media platforms we have. They've been sharing the links as well to be able to register. And we hope to see you there. So thank you so much.